let me ask you something. If you were renting a house, would you invest $30,000 in a kitchen renovation? Of course not, because the owner would benefit the most from your investment. In the world of insurance, the typical fully insured model is like renting a house. With a fully insured health benefit plan, an underwriter determines how much your insurance plan will cost and sets the premium accordingly. Of course, this premium includes not just claims utilization, but taxes and a healthy profit for the carrier. So if you decide to implement cost containment programs, do you really think the carrier will lower your premium? You'd probably have a better chance of seeing a frog grow hair. Wouldn't it be great to have more control, data that would enable you to customize programs and retain all the profits and cost savings that you deserve? Fortunately, there is a way with self-funding. So why don't more employers self-fund their benefit plan? A common misconception is that self-funding is too complex, requires too much expertise, places too much burden on HR teams, and is just too risky. Let's address some of these concerns. A self-funded plan utilizes a third-party administrator to do everything that a typical carrier would do, like pay claims, manage eligibility, and provide ID cards in a network of doctors. Our experienced service team handles the day-to-day issues that typically arise. This takes a lot of the complexity out of the equation and frees up your HR resources to concentrate on other things. Perhaps the biggest difference between fully insured and self-funded plans is in who owns the risk. With a fully insured plan, the carrier assumes all the risk. Because of this, you pay a higher premium, higher taxes, have less flexibility, and lack insight into your population's claims and disease states. So even if you wanted to customize programs to fit to your employees' needs, you wouldn't have the data necessary to guide you in that process. When you self-fund, you own the risk. This gives you greater control, more data, decreased taxes, and better cash flow since you only pay claims as they occur instead of pre-funding claims by paying large monthly premiums. In order to limit liability, you need to purchase some protection for your plan. There are two types of insurance you can purchase to limit your risk. Specific stop-loss insurance protects your plan from catastrophic claims like cancer or organ transplants. When tragedy occurs, the stop-loss carrier pays the claim once you've met your deductible. Aggregate insurance protects your plan from overutilization by your entire population. So even if everyone gets pneumonia, breaks a leg, or swallows a quarter, you will only be required to pay a set amount before your aggregate insurance carrier pays the balance. Even with safety mechanisms in place, self-funding can be intimidating. Increased control and flexibility provide limitless choices and options. It can be hard for an employer to know which solutions are best for their unique circumstances, and that's where we come in. The employer group is at the very center of every decision we make, every solution we create, and every service we provide. Our complete independence and transparency allows us to produce unparalleled results. We have been guiding employer groups through self-funding for nearly 2 decades. Our extraordinary programs combine the best solutions in the industry with cutting-edge technology to reduce wasteful spending and drastically bend the trend of rising healthcare costs. Contact us today to learn more.